for Addison. So Addison, thank you for being here, and thank you so much, Mr. Chairman. I'll yield back to you.
Thank you, Senator. Senator Moody.
Thank you, Senator Scott. I agree with you, Senator Justice. I think we're all sitting up here thinking that we can do better, especially with us senators who sit around a lot. I am only 3 weeks into this tenure, and I am noticing that we sit around a lot. So thank you for being here today. Thank you, Chairman Scott and Ranking Member Gillibrand, for holding this important hearing. I think it's important not just for those of us that are learning more about it on the Aging Committee, but those who may be watching and sharing this information around the country. I agree with Senator Justice. Becoming more aware and making sure that others within our states are aware is an incredible first step to making America healthy again. And so thank you for taking the time to be here. I know it isn't always easy to break away from a practice or travel from another state across the country. I really appreciate it. I know some of you are residents. I am the newest senator from Florida. I know some of you are my constituents, so I'm grateful. One of the things that I think our longstanding reactive approach to healthcare means is we spend a lot more money than we probably need to. And I was most fascinated by your work, Mr. Butner. I've actually watched some of the documentaries that you've helped on. In fact, I've recommended my own parents watch those. And I'm fascinated. I'm from a state that is growing exponentially, and there are many new communities being built. There's also those that are going back and trying to readdress how they might rethink their existing communities. And I was really taken with some of the statistics that you included within your written testimony, and some of the places that you've worked with reported annual savings. And so cities reported not just a drop in their physical BMI, but an actual drop in cost to their cities. I think it was in Minnesota, you saw a town that saved 30% of their city worker healthcare costs since they started. I was just wondering, in terms of existing communities that are trying to go back and reconfigure, or new ones that you're working with to kind of build a city to highlight health and community and healthier options, have you done a study that shows how much might be saved versus what the input of cost to a community or city would be?
I can give you some benchmarks. So if you, not working? Oh, did I turn it off? So if you drop the BMI or the obesity rate in a city of 1 million people, it saves about 19,000 heart attacks over time. The average heart attack costs about $120,000. So you don't have to have a big movement to make a big difference. But essentially what I'm pitching to all you guys is the notion that we tend to think in silver bullets. There's going to be this one magical intervention that's going to save us. Meanwhile, we're surrounded by what I call silver buckshot, these small nudges and defaults. And in all due respect to the federal government, it's a slow-moving tanker. It's hard to move. But city governments, municipal governments, they can move in a hurry. A mayor and a city council in coordination with the business community, they can get a lot done. And simple things, and by the way, we've done this in Naples, Florida, and we're doing it in Jacksonville, something called a complete streets policy. Do you know you can raise the physical activity level of an entire city by 20% by just building streets? So they invite pedestrians, they invite people to socialize, they invite cyclists instead of just cars. That doesn't cost any extra money. Once every 7 years, a street needs to be redone, and when you redo that street, you can just as easily build it for humans and cars rather than just cars. So it's seen clearly. We know there's a clear correlation between the number of fast food restaurant permits and the obesity rate of a city. If you live in a neighborhood with more than 7 fast food restaurants within a half mile of your home, you're about 35% more likely to be obese than if there are fewer than 3s. In the hands of a city council member, they may decide, well, our children's health is more important than another burger joint, and make the changes appropriately. Billboard advertising. We know that 2 identical neighborhoods, and one neighborhood has billboard advertising, the other one doesn't. The neighborhood with billboard advertising has about 15% higher BMI. So what we try to do is rather than telling cities what to do, we show them the evidence. We give them about 30 different policies in each of smoking, built environment, and food, things that cost them nothing. And we ask them, would this be effective for you? Would this be feasible for you? And if they say so, then we help them get it done. The wrong thing to do is to come in and say there's a silver bullet. The wrong thing to do is to come in and tell people what to do. But when you show them the evidence, America's smart. There's a lot of very smart mayors and city council people who are tired of seeing their children grow up overweight and tired of seeing their neighbors die prematurely of heart disease and type 2 diabetes. And this is something we can act on right now. And I guess the pitch for federal government is to think about empowering, designing cities for health rather than continue to look for just the silver bullet.
Thank you, Chairman.
Thank you, Senator. Mr. Butler, we hear a lot about diet and exercise, but you've said social connections and purpose are just as important. What can we do without more government spending to encourage stronger communities and healthier lifestyles?
My name is